Upper eyelid surgery or upper blepharoplasty is one of the most common things I do. This is for people who have significant excess skin in their upper lids. It can be done under general anesthesia, but if it's an isolated procedure, most commonly we do it under local anesthesia, usually with some sedation, like some Ativan. It involves making an incision in the lid crease and removing a very carefully measured amount of skin from the upper eyelid. Anytime you make an incision in the skin, there's risk of scarring. However, this usually heals extremely nicely because it's in a very natural crease. There's a small risk of infection or bleeding. If we do go through the muscle, so the muscle is just under the skin, we sometimes do that to tease out some fat pockets, particularly in the inner part of the upper eyelid. Once we do that, there's a very, very small risk of bleeding inside the eye. And because there's a contained space, there's a theoretical risk of putting pressure on the eyeball, even causing vision loss. That's something I have not seen. And there's also muscles that move the eyes. And if they are injured, it can cause permanent double vision, something I have also not seen in my practice. But those are things that everyone has to know about. In addition, anytime you do a surgery, there's a risk that you have some asymmetry or there's not enough skin taking. And those are all reasons why you could need a revision surgery, although those are rare.